Hello all, I'm Dr. Bhargavi. I'm currently preparing for ADC exams and I cleared my part 1 exam and now I'm preparing for the part 2. Have given the part 2 one time and then during the course of preparation I managed to look into the ADC documents to understand why communication is so important, right? We all need to understand that why they are putting so much emphasis on communication. Let us try to break down and understand why it is very important. See, in this generation of AI, if you feed the information of the patient in the software, you will automatically get the diagnosis. And with your subject and knowledge, you need to decode whether it is right or wrong. That is what you're going to decide. Now, here comes a point wherein we have to decode the information to the patient. They have every right morally and ethically to know what is happening with them and what are we gonna do about it to improve their condition. I hope everyone agrees on this one. Right. So as I kept on practicing the role plays and everything, by the way, I have to tell you, once I've given the exam, I cleared the communication part, but a little bit glitch came with the technical part and I'll be clearing it. But I just want to come forward to in front of everyone, just try to tell you why it is very important for us to put much more emphasis on the communication. So, because we need to provide a safe and ethical and a patient-centric dental care. I hope everyone agrees on that. So, after all, we are taking money from them and we are doctors. By Hippocratic oath, we are ethically and morally responsible for that patient. Though we are treating, managing the teeth or dental conditions or oral conditions, we are responsible for the patient. And everything we do should be centered around the patient. It should be safe and ethical. So, first of all, it starts right from the reception area, right? In our normal clinic. From the reception, how they receive the patient, how they make them feel comfortable, hospitality. It's everything about hospitality in the reception area and the patient lounge, right? That is there. Now, once the patient enters into the clinic for the first time, second time, third time, we will eventually develop the rapport. But how will the rapport develop? Some patients will be normal, they will not be having any dental anxiety. Some patients will have a lot of dental anxiety and they'll be terrified to enter into the clinic. They'll be looking around with a question mark and they'll be suffocating in the clinic. So it is very important for us to develop a rapport with the patient. Why? Because we need to create an environment in which they feel safe and comfortable. Right? We have to create an environment by which they feel respected. They should feel heard. We should hear them and they should feel comfortable and able to express their concerns. Otherwise, how will we know what is their main concern? They'll come with the pain, but surrounding the pain, there may be other conditions which are also related, which might have led to the occurrence of pain. So, for that, we need to develop rapport. We will automatically gel well with our friends, but strangers, patients are strangers, first time patients. So, we need to make them feel comfortable. That is why in the examiners, we in the exam also we see them for the first time. It is like they are entering into our clinic and they are enacting. They are enacting very well. Methodical acting also they are doing. They are trying to give us various kinds of situations like indifferent patient, very angry patient, very talkative patient. So we can face with any kind of patient in a routine clinical setup. That is why they are trying to act in such way so that even from those type of patients also, we can gather some information and we will try to address their problems. That is why the examination is conducted in such a way. It is very ambiguity will be there, right? We don't know what they will react. We don't know how they will react. Until I gave the exam for the first time, even I was of the assumption that nothing will be there. They will just sit and I will ask questions, they will answer, and accordingly in the clinical situation, how I do in the same way I can do. I thought that. In fact, that is right to certain extent. I just did extempo. Though I prepared a lot of times about the scenarios, I discussed with my role play partner, but going on the exam day in front of the examiner, the original clinician in us comes out. Right? Nothing actually what we practice will come in front of the examiner. The original clinician only will come. Maybe we might remember some acronyms. So that is why they want to test. Okay, suppose suddenly an angry patient came, how are we gonna deal on the first day? because this is a single time examination. We are dealing with the new patient. So we have to create the atmosphere like that. That is why they put a lot of emphasis on the communication, computing and decoding the symptoms and signs, reading the radiographs. Now, for everything, software has come. As a human, being human, right? We all know. So we have to be human, and as a human being, we have to be a human. In that aspect, we have to communicate properly, talk with them, make them feel comfortable. We can do with friends, but these are the strangers. So that is why they're asking us to practice, develop, seep in all the communication aspect. Right? It's not like we can just mug it up and blurt it out in them, even the communication aspect also. That doesn't work like that. We need to really talk to them. That is what they're listening. For that, what we need to do, first of all, to understand their concern, we have to listen actively. Really listen. Okay? A lending ear is very big asset for us. We have to listen. We should not give our opinion with the first sentence itself. Let them talk. Okay, and avoid unnecessary interruption, unless otherwise they are going beyond what is needed. They're telling the family stories or something which are not relevant to that. We have to avoid unnecessary interruption, and we have to use verbal and non-verbal communications, even an eyesight, even a nod, even an empathetic eye look. Everything matters to the patient. They feel heard. Right, we all know. See, whenever we are suffering or whenever we are feeling bad, we are feeling down, we would like other person to listen to us. Just be there, listen to what we got to say, so that we will vent our problem out. Right? In that way, they will understand clearly what we are feeling. In the same way, if we let the patient talk and if we do the verbal and non-verbal communication, then they feel heard. We will be very empathetic to them. They can feel the empathy, not sympathy, mind you. We have to make them feel empathetic. We have to be empathetic, right? Then only they will clearly tell us what is happening with them, right? So now we had a nice pleasantries with them, conversation with them. Hi, hello, please sit. Now tell me what is your concern? So and so, Mr. or Mrs. or Miss so and so. Please tell me, how can I help you today? I'm here today to listen to you. Tell me what I can do. Then they will start slowly. Now you're listening, actively listening. So you need to ask open-ended questions. We already know that basing on the therapeutic guidelines, what are open-ended questions? They we need to let them talk. No yes or no answers. We need to ask what is your concern? From when the pain is starting? How did you feel? Did anything help with the pain? Right? All the pain related Socrates question. Anything about regarding the main concern, we have to ask the subsequent questions. Right? They should be mostly open-ended initially, and then slowly we can narrow it down to get to the diagnosis and understand what is their complaint, understand their medical history. We are treating the patient as a whole, not only teeth. Holistically, we have to treat. Many systemic conditions are having effect on the mouth. Right? In that sense, we have to act holistically, ask questions holistically. If they're using certain medications, if they're having certain health conditions, systemic health conditions, drugs will play an important role, right? The dosage of the drugs, how they interact with the other drugs, and what systemic conditions can give side effects. Systemic conditions have side effects on the oral cavity. So we have to clearly listen. What is the dental history? How many times they visit the dentist? Last time, when was their visit? What are the concerns? What are their expectations? Do they have any expectations for today's visits? Are they having any preferences about time, schedule, or anything? Or any other factors which can influence the treatment? Slowly, we have to ask the questions for the patient. That is why the first visit is really very important. Now we have gathered information, right? We have got a provisional diagnosis idea, right? And we might do the clinical examination, right? And we will decode all the things. What has happened? What are the findings? What are the correlations? What is the radiograph suggest? Everything we know. And we take the help of AI as well with the software. Now comes the point wherein we need to explain to the patient. Now, explaining to the colleague or the students is different. We can talk in scientific language. Coming to the patient, what is the way we have to talk to them? We have to talk to them in a way wherein they can understand. and we have to minimize the jargon. What are they going to understand? Irreversible pulpitis, apical periodontitis, nothing, right? You draw. You draw a picture and tell them what is happening around. They will be able to understand, right? We have to adapt our communication according to the patient's level. What is the level of their knowledge? What is the health literacy they are having? What is the cultural background they are having? Are they acting any inhibitions are there in them? Right? Any communication, special communication requirements are there? A language barrier is there. Do we need a translator? Or are they able to comprehend or not? Do they need any assistance? Any family member should be there for them to understand the condition. All these things we have to understand and explain the condition to them. So that is why then we have to tell this is what happened. These are what the treatment options. Right? They should clearly know what will happen if no treatment is done also. That is why no treatment is a very important aspect in explaining to the patients. Right? We have to explain what are the available options, what are the benefits of each options, what are the risks associated with it, and if at all for each treatment option, what is the cost, and what are the limitations, what are the expected risks, and what is the outcome to be expected. We can't give any unrealistic expectations. Again, they'll come back to us. Everything should be clearly mentioned, drawn if necessary, and make sure they understand. That is useful for you legally as well, ethically as well, for the patient to decide as well. Right? So once you keep giving the options, you need to confirm from them. Do you understand? Am I clear? Right? Instead of asking, my bad, instead of asking, do you understand? Am I clear? Do you want me to explain again? Right? And give them time to process the information. If necessary, repeat again. So these are all they are seeing. Sometimes we wonder we don't finish the case, but we still pass the case. Why? Because they will see how we are responding to their concerns. Are we rushing out to finish the case in the 10 minutes? Are we doing that? Or are we waiting for them to understand? See, they will obviously know, examiners are so well experienced, they will know, right, whether we have subject or not. What they are seeing is how we are communicating with the patient. So they don't want us to rush. So don't be in a rush to complete the case in 10 minutes and blurt out what all we know. No, that doesn't work like that. And I am the living example for that, right? I'm the direct example. I faced that situation in the exam. I was skeptical about what is going to be my result because I'm not sure, there is no expression on their faces. The only thing I was telling in the back of my mind is, okay, come on. I have to maintain my cool. I have to answer to their concern. Concern, concern, concern. No rushing. Right? How much ever you finish within that time, it is good. Right? If you are able to complete in a proper way the entire case, it is good. But don't rush. So explain, ask relevant questions, explain what has happened and what are the side effects for this. Wait for them to ask any questions. Right? What will this happen? Consent now at the end of the first time visit, we will, before starting any treatment, we will take consent. That is informed consent. So we are telling everything, right? So we have to tell them everything. Then it is not about just merely taking the signature. We have to make sure whether they understood or not and give them opportunities to question us and clearly answer their questions. And shared decision making should be there. What is shared decision making? Right? Patients don't know the scientific knowledge. They don't know what are the harms of not doing the treatment. Right? We have to tell everything about it. We just don't have to tell, we have to tell, they explore the priorities and preferences, and we have to work out a realistic treatment plan. They might have some time constraints, financial constraints at that particular time. We have to see what can we do immediately. If they can't pay, is there something which we can do today to bring them out of the pain or to prevent the tooth loss, to save the tooth? We have to give every option to them. That is why we are sharing the information, and decision making also we can share. For suppose they make a decision wherein they don't want to do any treatment, just give the painkillers, and you see that without doing the treatment, the condition may get worsened and patient might have to suffer some consequences about it. We can't simply say, okay, you asked for no treatment, I'm giving you medication and sending you. And if something happens, if the swelling comes, right, patient might say, you didn't explain to me about this complications that could happen. So we have to tell them clearly, not simply telling them what treatment they should have. We have to explore their priorities and create a realistic treatment plan. This is very appropriate and acceptable to them. It should be acceptable and appropriate to them. That is why they are putting more emphasis on the communication. Okay, done. Shared decision making is done. The patient signed the consent form. Now, what we have to do, the next step? The next step is during the treatment, what we have to do? We have so many cases as well. In between the case, we are having a condition wherein root tip broke, crown broke, something happened, right? Even patient comes after 1 week with a hematoma. So during the treatment, what we have to do? We have to continue communicating with the patient. See, first of all, I'm doing this, I'm starting this, I'm giving you some injection. You'll feel numb in some time. It will stay for so and so hours, 1 hour, 2 hours, according to the injection we give. And explain what is happening when appropriate. If something happened, unexpected happened in the middle and patient needs to know, we have to explain to them, right? We have to keep monitoring. We have to look at them. Not only at the teeth, we have to look at the face, read the signs, any signs of anxiety is coming, any signs of pain, or they are trying to, sublim the pain, right? They are trying to manage, suppress the pain by themselves. We have to see for the visual clues as well, for any discomfort or concerns. Right, we would love it, right? When anybody does that for us, we would really love it, right? That is why communication is, even during the treatment, is very important. Informing them when appropriate, and then communication after the treatment. We have to give clear instructions. We have to tell what they will be expecting, what they should expect in first 24 hours, any possibility of swelling, and how severe the pain could be. If anything, if bleeding is not stopping, what they have to do. If they have any medical condition, everything should be crystal clear. Please don't rush. This is what they are checking. We should be able to know what we are doing and why we are doing. See, exam passing and failing is a different aspect totally. Sometimes luck should be there. On that day, our brain should work. We should be in a complete, solid, good mood, and nothing should affect us. That is a different thing. But this is what they are testing us, and this is what we should do. We are all good dentists. We already know how to talk to the patient. Depending on the country, the way we talk to the patient and the way a patient talks to us can be different. So maybe in our country, we will be more paternal or maternal, bossing the patients. In some countries, they are very submissive to the patient, doing whatever the patient asks. So that is not. We have to be in a middle ground. We have to make them understand. We have to guide them appropriately. Safety netting should be there, right? What they should further. So now we talked about the patient. The communication is important not only with the patient, your dental assistant, right? Your colleagues and the senior colleagues, contemporaries, colleagues in your juniors, everything. Communication with them is also very important. Don't treat anybody without respect. Treat them with a good respect. Good rapport should be there, right? Treat them in a decent manner. That is why, because if the dental assistant doesn't work properly, our work will not go forward. Four-handed dentistry will not go forward. We can't do everything by ourselves. So please treat them respectfully. Ask them their concerns. What is their problem? Right? Communication is important with the assistants, technicians, other healthcare professionals to whom we are referring. Everything is important. Right? All said and done, finally, documenting the communication is also very important. That is why, my dear friends, I came today forward to tell you what is the importance of communication. Why they are emphasizing so much, why the Australian Dental Council and all the Western and Eastern countries are more particular about how we are communicating with the patient. Now, even in India, because I am from India, I am also sharing that. They are also the pattern of questions. The way they are teaching the students is also changing because communication matters. That is what we have as a humans. That is a big asset we are having. AI robot cannot create the empathy. It will be automatic mechanic, right? So that AI can't do. That is the thing which you can do, we can do. So that is why they're putting more emphasis in the communication. And please don't get scared listening to all people, all everybody's exam experiences, because that could be different on that particular day, and you could have a different scenario on that particular day, right? Always remember, if an angry patient comes also, just we have to control our reins. We can't get stimulated, right? We have to talk calm and composed way, right? We have to make them talk. We have to ask them. We have to tell them, see, Mr. So and so, if you don't tell, I will not be able to understand properly. Only if I understand properly, I'll be able to address your concerns properly. If they are angry, I understand that you're angry. But let me tell you what we can do about it. This is something we have discussed earlier. This is something that doesn't usually happen. It happens only sometime. I am sorry that you are going through this, but I am here to help you, to make you feel better. These are some types of empathetic phrases. Especially the people, doctors who are having the kids in this generation can understand how we are talking with the kids, what they're expecting us to talk in which way, right? We need to ask them. We need to ask and confirm them. Are they comfortable? Are they okay like this? Okay? Okay, friends. I hope you like the video. And if you like it, please let me know. We can discuss all the OSCE cases, we can discuss about it. We can just summarize the discussions, understand what is happening in each case, right? Goodbye.